Good afternoon, ladies and gentlemen, watching from all around the world. Welcome to BHIS TV. As we always say, your health, our priority. All right, today on the show, we have a very distinguished guest in our midst today who would be sharing some light with us on some amazing programs in the Bayelsa Health Insurance Scheme. So today we'll be talking about the informal sector in the BHIS. And with me on set is the highly esteemed head of department, marketing department, none other than Dr. Richard Wilson Tweedy. You're welcome, sir.
Thank you very much.
Nice to have you on set.
It's a pleasure to be here.
Thank you so much for coming.
Thank you.
All right, now we understand that the Bayelsa Health Insurance Scheme is focused on providing excellent, affordable health care to all Bayelsans, and it covers Bayelsa as a whole. All right, but for some time, most persons might assume that the scheme is focused on the formal sector. All right, because I understand that the BHIS has the formal sector, which comprises the organized public sector, that is government ministries, departments, and agencies. Okay, but there is another aspect, a sub-scheme in the BHIS, which is the informal sector. So, Dr. Tweeby, can you shed more light on the informal sector? What exactly does that cover? Thank you.
Thank you very much. Well, in Bayelsa Health Insurance Scheme, the essence of this agency is to bring health insurance to everybody in Bayelsa State.
That's true.
Initially, when they started with the formal sector.
Yes.
Because for us, it was a starting phase. You have to get better before you move to the next level.
Right.
So we have been with the informal sector for a very long time. And last year, we introduced the formal sector. The informal sector into light.
Okay.
The essence for us is to make sure that all Bayelsans have insurance.
Okay.
Because we are trying to meet the 2030 goal of universal health coverage.
Amazing. The 2030 goal. Yes.
2030. The World Health has said in 2030, countries should have universal. Every country should try to attain that universal health coverage. And for us, it's important because insurance health is the priority of the state government, and that's why this body is formed. And we'll be dealing with the informal sector. Now we're dealing with the formal sector. We started the formal sector last year, around December. And the formal sector includes people that are not in the organized labor, or the informal sector includes people that are not in organized labor or not civil servant. As we all know, everybody will get sick one way or the other. Do you understand?
That's true.
So we don't want a situation whereby it's only people that are working in civil service that should benefit from this. And that's why it is important, very important to us that the informal sector is on ground and running. So this includes everybody, includes the market women, the tricycle operators, the students, teachers in various schools, and everybody not categorized to be in the formal sector.
Okay.
So that's what we're doing present.
All right. Amazing. So to the market woman in Swali and the trader or sales boy or sales girl in a shop in Agua, or even the farmer in Uti, for instance, what do you think would be the benefits of this scheme right now to those people? What exactly?
Well, as you know, it's all about health insurance. And health insurance is all about health of the people. And the Bayelsa Health Insurance Scheme is trying to make sure that everybody, no matter your level, your status in the society, should have equal right to health. So you are a farmer in one of these localities, say Odi, for example, if you want to use the hospital that the governor of Bayelsa State is using, you can also use that. So we bring health to a level where everybody has the same access. That is the essence to us. So that is one good benefit. The person in the village can go to the health facility and get health services without paying out of the pocket. Now the problem we have in this part of the world is because we don't have health insurance. A lot of persons tend to patronize the traditional or herbal people
That's
more
true. That's
than
true.
coming to the hospital,
That's
because they
true.
feel that when they go there, first of all, they don't have money to pay for the services. Now, but with health insurance, with a little token you're paying every month or
Okay.
every year or quarterly, you can go to the hospital of your choice and get medical services without paying from your
So
pocket.
any hospital.
any
at all.
hospital, especially in the villages, most of the health centers are with us.
Okay.
And now we have a referral system. Yes,
Okay.
we have various categories of the health insurance, which everybody everybody can have the same, which everybody in this in the insurance can access. We have the primary, secondary, and tertiary.
Okay.
However, your first contact is the primary center, which is usually the health center and all that. And if it's a case that they cannot handle, they'll refer you. So we have a referral system. Do you understand? So somebody in OD, for example, will say, okay, there are not much private hospitals there, or there are not much secondary facility. I don't need health insurance. It's not like that. When you go to OD, you go to the health center. If it's something they cannot do, they will not take you to the next level. And you're expected not to even pay any money when you get to that same level. So that's how it is. Do you understand? We have a referral system that is working very well.
Oh, excellent, excellent. So, but earlier you mentioned that the farmers, of course, get access to it. All right. So anyone who is not in the formal sector could have access. All right, to this scheme. All right. Now, this leads me to my next question. How can these people register?
Yeah, very, very simple, very simple. Right now, we are talking with a lot of persons. You know, we've spoken to a lot of organizations. We're working with them right now, like the tricycle organization. And you know, there's tricycle everywhere.
Yes.
So through the organization, we are meeting them.
Okay, through the associations.
We are meeting them. Also, our people have started going to the locality to also discuss with community leaders and stakeholders, and then anybody that is ready to join.
Right.
Now, if you're ready to join, what we need to do is to go. We can go as far as their community to capture them, to do their registration. As we speak now, we have the capacity to register about 1,000 persons per day.
That's
we
amazing.
Have
That's amazing.
In BHIS.
That's amazing.
So if a community wants to register all the people that are not civil servants in their community, we can do that in 1 or 2 days. Do you understand what I'm trying to say? So we have that capacity. So first of all, we've started engaging them. We're engaging the stakeholders. We're engaging the CDC chairman and all that. And whosoever that is ready can call upon us, and we'll go and do the registration there.
Excellent. So for those listening to us right now, all right, you rightly mentioned that you have the capacity to go down to wherever they are to do the registration. Now, someone might be asking, okay, now I definitely can get registered, but what requirements? What are the requirements? What would enable me, or how would I register? One, okay, what are the requirements? Do I need to have my NIN? Do I need to have my BVN? Do I need to present my statement of account? No, such questions might be going through their minds right now. So what do you have to say about that?
Well, the truth of the matter is, Bayelsa Health Insurance Scheme is a public agency. So we are not here to make profit out of anybody.
Okay.
So we don't need plenty requirements. First of all, we don't need your bank account. We don't need your NI number. What we need is just your passport. And you fill in our form. That's it.
The passport photograph and you fill the form.
Photograph and you fill in our forms. Then the token that you pay.
Okay, you just talked about the token.
Yeah.
So there's a particular amount.
Yes.
How much is it?
Well, the money you pay per person for the formal sector, their money is from source. You know, they pay percentage from the salary. But for the informal sector, it's not like that. So every individual has a token he or she must pay per person, and that money is 1,920. 1,920 per person per month per adult.
Okay.
However, for children is 1,000 naira per child.
So can we go over that again? 1,920
for adults.
For adults,
right?
Okay.
And 1,000 naira for children per month. That is what you pay, and with that you can access healthcare service.
All right. How about are there packages for like families, maybe family of 4, who may want to come on the scheme?
Yeah, for us, there's no such package.
Okay.
What we do is, if you have a child of, say you are a family of 4, husband and wife and 2 children, you pay 1,920 times 2 for adults, then you pay 1,000 times 2 for child. So you just pay that money in total. then everybody can access it.
Wow. That's amazing. Thank you so much. All right, now going forward, you know and understand the Bayelsa terrain. Now, there are so many of our communities that are riverine, okay, and that poses quite a challenge, right, for some persons or for some government organizations to have access, to development and all of that. So, for those communities like Age, for instance, Agoro in southern Ijo, they have to travel for hours just to get there. How does the BHIS intend to ensure that Bayelsans that reside there have access to this scheme?
All right.
Would you travel that way?
All right.
Or what's the plan?
I think I understand what you're trying to say. The truth of the matter is, as a matter of fact, first of all, I want to thank the workers too, because we're very passionate about our job. And I want to tell you that we have the capacity of going down to those places to do registration and all that. As a matter of fact, we have started doing it.
Wow,
we have some certain partners that are partnering with us, and some partners are partnering with us, and sometimes we go as far as BHIS, Sangana, to do registration and all that. So it's something we have been doing. It's normal for us. So we can go anywhere in Bayelsa State to get you registered.
Okay, you mentioned partners.
Yeah, we have some partners.
So we need to give them the accolades. What partners?
We have people like UNICEF, the basic healthcare provision for when the federal government is doing some things with us.
Awesome.
So they're trying to. That is for the indigent people that can now afford healthcare. So we have those kind of things running, and sometimes we go as far as these localities you're talking about to do registration. So we are used to it, and so it's normal for us. Yeah.
That's awesome. So presently, there are thousands of people listening to us right now, or watching us. So, and I'm sure from these, the surge of people who would be interested or who would come to to the BHIS to register would increase. All right. So now the question is, what are your projections? Because now you do registration, you take the registration to them, or they come to the BHIS to register. Now, in the future, do you think it's possible for someone to sit at the comfort of their home to register on BHIS?
Yeah, I think very soon we'll have a software where you can just sit in your home and do the registration. However, we should also know that it's not everybody in this terrain that have that access to internet and all that. But people abroad or anywhere, you can do it. Very soon we'll kickstart that process. I think they are working on something on that. Our ICT staff, we are doing something.
So the ICT department is working towards it?
They're working towards that.
Wow,
so very soon we'll start online registration. You don't need to come to our office to do the registration. You can do it right in the comfort of your home.
Wow,
yeah,
that's phenomenal. So with a phone, you can easily just do registration and
go online and do your registration.
So Bayelsans, you've heard the informal sector is open and ready for everyone to register and have access to affordable healthcare. Affordable, not just affordable, but efficient healthcare delivery. Wow, so thank you so much, Dr. Suebi. It has been nice having you, shed light on the informal sector and the BHIS. Thank you so much for coming.
My pleasure. You can call me anytime. I'm willing to do anything.
Thank you so much. Thank you so much. Thank you very much. All right. So until come your way next week, see you. Same time, same station. Thank you very much.
My brother, don't